we're diving into the mystery of the human eye.
Poster child now in the NBA for doing like sports vision training and things like that is Steph Curry, and everybody knows that guy's like the best shooter of all time. And 2020 means things that are 20 feet away look as if they're 20 feet away. 2025 will mean it's 20 feet away, it looks like it's 25 feet away. So already the gap between that person is 5 feet, they're perceiving it 5 feet quicker than I am. Perception is huge. Visual perception is some of the stuff that, within our realm of what we're doing. You ask about, the eye and the brain. To us, the eye is obviously part of the brain.
Sitting close to the TV is going to kill your eyes. It's going to damage your eyes because you're sitting way too close to the TV. You've heard this. Myth or truth?
Can I say in between?
So tell us a little bit about yourself. Tell us about your journey into eye care.
So I, in ninth grade, back when, we first knew each other way back when, I don't know what it was. I was just like, oh, the eye seems pretty cool. I'd like to do that. Up until that point, my whole focus was just like, I love Legos. I want to do engineering. That's just how it was, right? And, that was my plan. 9th grade, 10th grade, 11th grade, senior year, want to do eyes. Applied to NC State, and I was just like, wait a minute, I hate biology. And I was like, if I don't get into optometry school at the end of my undergrad, I can't do just biology. This isn't going to work. I'm a numbers person. I like to do all of that. So I decided to go the route of civil engineering and take all of the prerequisites, and got a minor in biological sciences and graduated with a degree in civil engineering. And thankfully, I got into optometry school. So I was like, all right, this worked. So my love for Legos worked for something. Did civil engineering.
Got me through the first step.
Got into optometry school, and luckily the eye, learning about it, it's half sciences, like half of the biologies, microbiologies, chemistries, biochemistry, all of that. Then the other half is optics, which is math and the engineering component that I had already learned. So it was kind of great to get in there and like, all right, have half of it. Cool, I've got this. I might have even studied past what we need to know for this in understanding it with my undergrad degree. And now I can focus on learning over here. Like you said, I went to Nova Southeastern down in Fort Lauderdale, 4 years there. And it was a lot of studying, a lot of back-to-back finals and tests, and then afterwards a lot of boards. When I was done, I was choosing between going to live in the DC area or Chicago, because my sisters were in Chicago. I was like, I'll come back to North Carolina eventually, kind of thing. So I was like, all right, let's go to Chicago or DC. And I was a huge Washington football fan. And I was like, well, it's really weird to visit a football team. Yeah. It's like, it's really weird to visit a football team, but you can always visit your sisters.
Yeah.
So I chose to go move to DC. Purely based off of that. One of my bucket lists was to have season tickets for them, and I got it within the 3 years that I lived there for 1 year. Yeah. And then after that, I moved back to North Carolina to be around family and friends, and it's been amazing ever since. Worked at a private practice for 4 years, got my experience learning how to manage a practice kind of thing, and then started a practice with one of my friends in June of 2014. And in the end of 2020, like during COVID, bought my partner out, and now it's just been me solo running the practice and doing all of that. And we'll be celebrating 10 years this June. And this past May, we moved into a bigger facility so that now we can actually do more of the specialty and fun stuff that comes with it. It's not just the, hey, better 1 or 2 components. Like, oh, we've got cooler stuff that can be done with the eyes. Yeah.
Congratulations. I mean,
thanks, man.
10 years.
10 years, yeah.
And then balancing between caring for patients, studying the sciences around the eye and the trends and sort of technology that's happening, and then the business.
Yep.
You have to balance.
Oh, absolutely.
And family.
Yeah, and family, of course. Shout out to my new son, 7.5 months old. So love that. Love the guy. And now he's letting us sleep, so we love him even more, kind of thing.
Yeah.
So it's just.
That's right. That's going by fast.
Yeah. So it's definitely a balance. Like you have to put on different hats within the day of hey, dad, husband, son, my family lives close to here, brother. And then, oh, I'm at work, doctor. Oh, no, business owner. Oh, boss. Oh, managing, going from here and trying to do all of that. But, if you surround yourself with the right people, so family's obviously, a great lean on point, right? And then if your team is great, which my team is amazing. So it makes things a lot easier for you to be able to do when you surround yourself with the right people.
Right. And it's hard to wear the same hat that you are wearing at work. When you come home, you have to kind of put on a different hat.
Yeah.
You can't use the same approaches.
Yeah.
Right.
Things
you're doing at work.
100%.
But you're still the same person.
Exactly. So you're the same person. We joke at work that, when you walk in the door, it's almost like, hey, and scene, like we're actors, like, outside of the office, I'm just a regular dude. I'm wearing shorts and a hoodie or a t-shirt, in a hoodie or and a hat, excuse me. And then you step into the office, like, all right, no, I'm professional. I'm a doctor. So now I have to act like this certain way. So like in your mind, you step through that door and everything changes. Okay, now I'm focused on everything from the science side, from the healthcare side, from the business side and managing side. And you just switch as you literally move room to room back to your office, coming back up there. So it's cool because it keeps your brain stimulated. And I can honestly tell you, I love my job. I love what I do. I love my profession. And, a lot of my friends look at me and they're like, man, you're crazy. You're the only person who actually we see loves their job. And I'm like, that means you guys got to do a little bit different, with yours. But it's like, no, I love it. And I think part of it is that freedom of being able to switch with all of those roles and doing, what I want to do makes a big difference.
Well, I mean, you see burnout happen in the medical profession with nurses, with physicians, especially in ER settings and everything that's happening, but also in other high stress, high intense professions. You see a lot of burnout happening in the legal profession.
Yes.
A lot of attorneys are, I can't do that anymore.
Yeah.
That was a lot long hours or whatever it is. So have you found any I guess ideas or mechanisms that help you sort of deal with that from a day-to-day basis? Or
I think gratitude is probably like the biggest thing you kind of have to go back to with that. Because burnout is real. I see it with colleagues. I see it with, friends in different professions. I know a lot of lawyers. I do know a lot of doctors, like everybody. Exactly what you said, nurses across the way. I think you just have to be thankful, for what you have and kind of put it into perspective that okay, there are people who would really kill for what I have or what I'm doing. So you want to make sure that you appreciate that all of the time. And you just got to appreciate the people around you. And, for me, doing what I do, I enjoy talking to my patients. I enjoy, getting to know them. So it makes it not just, hey, it's this basic, you come through. You want to actually make that connection with them. So then that helps you actually get through your job, but it helps you help the patient even more when you understand where they're coming from, you understand what they're doing, how they're using their eyes, how their day-to-day goes, then you can kind of help give them the best options and what they need with regards to eye care.
Yeah, and I think it's interesting when you say, you walk into a exam room and the patient that's in the exam room is looking at you. You're the doctor. There's a lot of trust and respect, and they see you, they perceive you one way, and then you go outside and you go home, and the perception kind of flips, right?
Yes.
I think that's interesting. And speaking of perception, that's a big part of what we're doing on this podcast. Is we're in marketing and branding, and in the world of branding, perception is a big topic because the way a brand is perceived internally may be different than how it's perceived externally. It may be different from what really you want that brand to be. So we're diving into topics that might not be your typical brand or marketing topic, but it might be another type of topic that we have a perception of, and our perceptions shape our perspectives. If two people are in an art gallery and looking at the same piece of art, they may have two different perspectives or perceptions as to what they're looking at.
Sure.
They may perceive that art differently. Some of that's the eye, but some of that is the brain.
Yeah.
Can you tell us a little bit about how the eye generally works, and maybe why that phenomenon may happen there?
Very complex, right?
Okay.
Like to answer that, but we'll tackle it the best way that we can. perception is huge. Visual perception is some of the stuff that, within our realm of what we're doing. You ask about, the eye and the brain. To us, the eye is obviously part of the brain. And, when I discuss issues with the eye or, show patients images of the back of their eye, I absolutely make note of the optic nerve and say that is the direct connect of the eye to the brain, because the eye is part of the brain. There are even some doctors out there who want to classify, or some researchers as well, who want to classify some eye diseases as brain diseases because of that correlation. So, in theory or reality, when you see somebody's eye, that's the only piece of the brain that you're actually seeing. So to go to what you're saying, where we're sitting at, where we're looking at things, like you're there, I'm here, I look out here, I'm seeing a different angle of an object when I look over there, and you're seeing it differently. So perspective is key. There's the old image of, I think it was like a comic strip, like a rhinoceros, like painting something, and it painting like another animal. And, the animal is just sitting there and letting it be painted, but for the perspective and view of the rhinoceros, they've got their horn in front of their eye. And so the painting has the horn in it, right? So like everything from a perspective aspect is really going to be on a subjective scale. What do I see? How do I interpret it? That is my perspective. And so, the eye and the brain, like that's a very big thing. That's why when concussions happen, when there's traumatic brain injuries, anything like that, we have a say, or we have input on what's going on as well.
Yeah, it makes me think a little bit about the classic optical illusion of the picture that you could perceive as being a young lady, young attractive lady. Others look at that same picture and perceive it as the old lady. And from the studies that I've looked at about that, it really has to do with your own individual unique paradigm and sort of your own map within your brain of what you're seeing and what, from your perspective, the experiences you've had that are shaping that a little bit.
Yeah.
Is that what is that how you kind of view optical illusion, or what is your take on sort of how we might look at something like that, and how that might impact other areas of life, I guess?
Yeah, and I mean, I guess some of that is also like, what is it, left brain, right brain, when you look at and view things. But, to an extent, even on some of that, and I know exactly what you're talking about with the young lady and the old lady example, you've got to look at corrective-wise, how is a person like seeing it, right? And if you're, I guess on a research level, I wouldn't do this, but somebody much higher up on doing research stuff and things like that could potentially do something on, is the perception of young lady versus old lady due to, left brain, right brain kind of thing? Is it from the angle of viewing? Is that what makes it? Is it from the distance of viewing? And is that necessarily just based off of those components? Or is it, hey, if you have a slight vision correction needed, like you're a little nearsighted, you're going to see it this way. And if you're a little farsighted, you're going to see it this way. Whereas if you're perfect vision, you have no correction, you can see it both ways quick, and you just flip it once somebody tells you to go from there. And, it's an interesting, component. And like, the brain, like I said, the brain and the eye are there, but it's like that the brain, man, is the greatest supercomputer that, we could ever have. And it's all in here.
Yeah, and so that's the connection, because the eye and the brain are two separate organs.
Correct.
But they're connected.
Correct.
Really, maybe more than any other organ. Two organs are.
Correct. So, yeah, I mean, it's a good way. So the eyeball, it would be the separate part. The optic nerve is the continuous part of the brain. So kind of like how the brain stem will go down and you have your spinal cord, which is direct connect. You've got the nerve that does the same thing with regards to the eye. Yeah,
because I don't think it's almost like breathing. We breathe, but we don't really think about our breathing very much unless you're doing meditation or something like that. It very similar with our eyes, unless you have really major and again, luckily I don't have this, so I don't. Maybe my perspective on this is different.
Sure,
another perception thing, but I don't think about how the things that I see in daily life, or just how I use my eyes and how that connects exactly with what I'm thinking, or how what I'm thinking is influencing potentially how those two things work together. It's just something I don't really think about. It's just, it happens. But maybe if you have an eye condition, you're probably more in tune with that because you're
Yeah,
having more issues.
I would say, and it's something actually, I'll touch on this in 1 second, but you say that and we talk about perception and perspective. If somebody is nearsighted, and we won't use any number because that means no significance to right now and how we're talking about this, but you're nearsighted, so you see things up close very well. You can't see things far away, and you don't know that you can't see things far away. You don't realize that things are supposed to be clear. So there are plenty of kids, like we end up seeing them at 10 or 11, never had their eyes checked, don't realize they're not seeing well, right? Mm-hmm. And that goes to what you're saying. And to them, hey, I'm seeing, this is the way I've seen everything. And, you see it on all levels, whether it's, from the educational, like academic standpoint or athletic standpoint, they've just figured out how to compensate to that deficiency because they don't realize it. That's how they view the world. They see objects completely differently, mm-hmm. and they make it work. Then you correct for their vision and they're like, whoa, didn't realize this is how I'm supposed to see. And so now you go into that perception and perspective aspect. Patients, when they get cataracts, and this was something literally we discussed last night at an educational dinner. People who have cataracts, they're not viewing contrast or colors the way that they're supposed to anymore. It's dulled out. It's not as clear. Their mm-hmm. night vision isn't great. And then when they remove them and get, cataract surgery done and there's a lens that's placed in there, they'll be like, why didn't anybody tell me I was wearing these colors? Like, this isn't like what I was thinking I was getting. I thought I was, getting this. This is not the fashion choice that I wanted to make. Or
purple and green.
Yeah. And it's just, you go from there.
Look
and some
like
people,
the Joker at
yeah. And some people, like, in the hair color, they'll change their hair color because to them, their hair looks off, and they'll be like, no, I need it to go this. And you'll, sometimes you see in, the older population, some changes in hair, and you're like, wow, they're going bold with that. And it's because contrast wise, that makes them seem like it's the normal one. And as soon as they have that surgery, they're like, no, let's get this back. Let's bring it back to where we want to be at. So perception is key, man. I mean, like how we see everything, that perspective, that perception, like those two words are pretty much mm-hmm. interchangeable and going from there. And it's, yeah, I mean, the eyes, I'm biased in this. I mean, I feel like the eyes are, one of the, you've got the brain, the heart, the lungs. You need those to, live and breathe. But to function, the eyes are very, very important to everything we do. I mean, talk to an athlete. It's like if I throw an athlete a ball and their eyes are closed, are they going to do anything with it? Like, without understanding and training how to do it the other way. And mm-hmm. Same with you. If you wake up in the morning and you just close your eyes, are you going to be able to do all of the things that you normally do without opening your eyes? So, yeah, I think, the eyes are up there. I'm going to give them a high ranking top 4.
Top 4 organs.
Yeah, top 4. Who got, brain, heart, lungs. So then we'll go to eyes.
All right. So that's your power rankings?
Yeah, I think right now, we're going to go through that. Okay. Yeah, we'll move up and down based on the season. So.
Yeah. Well, speaking of power rankings and sports, I've been calling it, ever since I've talked to you about this, I've been calling it athletic eye, but I believe you call it sports vision, or maybe an industry term is called sports vision.
Yeah, sports vision.
Insanely interesting to me because I had no idea until after I talked to you that A, this was a thing mm-hmm. that athletes can and should do, may not even be aware of, mm-hmm. but B, never really thought much about the eye as a muscle and how you could potentially be strengthening the eye to help you in whatever activity it is that you're doing.
Yeah.
Tell us a little bit about that.
So, the first thing, everybody, we talk about hand-eye coordination, right? So like in any sports, that's a very poor foot-eye coordination. Everybody says that. But, to us, that's a misnomer because you don't interpret or see that object with your hand or foot first. So, it really should be eye-hand coordination or eye-foot because everything is perceived. Everything comes through to the eye, to the brain, and then we decide what the output is. So input is always the eye. So that should be the first thing that's there. And if you think about it that way, why wouldn't training that mm-hmm. help us in our performance? So, we work with athletes on ways to improve eye-hand coordination, ways to improve eye-foot coordination, on spatial awareness, on peripheral awareness, and people are like, well, what's so important about peripheral awareness? Well, the more you can have somebody see further outside of their small cone, using contact sports like hockey, football, and soccer. People don't think soccer is a contact sport, but clearly it is. And you look at it that way, a person is able to protect themselves from concussions. When their body can see something quicker, they're able to get into a more protective position, so that way they're not going to have trauma, or from injuries, even not even just on the concussion side. So it's very important to do that. Very important to work on spatial awareness. Very important to work on peripheral awareness, and contrast, so that you can see the puck or the ball coming before it slaps you in the face, or knocks you down, takes your breath out, or to see that guy or girl that's about to hit you, whether it's lacrosse, football, basketball, any of that stuff. So it all starts with the eye. I can't, as I said earlier, I can't tell you, hey, let's go play football. We'll use that as an example and be like, all right, you're going to be the wide receiver, go run your route, but keep your eyes closed. I'm throwing the ball at you, and I could chuck it to you at all points. And so, some people will be, oh, what do the eyes have to do with this? And I just tell them, close your eyes, and then I'll throw the ball at them. And they'll be like, what the? And it's like, yeah, this is why. It all starts with how you see it. And in the vast majority of athletics, the majority of people haven't actually had their eyes checked to see what they need. And then, as we used that example earlier, I think that's the starting point. It's important to get your eyes checked to understand where you're at. And then from that, we work on improving skills, improving reaction time, improving the ability to see and perceive where the ball is, or in baseball for hitters to get that extra, millisecond. As we know, every 10th, 100th, 1000th of a second matters with what they're doing. I want to see the seams on the ball coming this way. So yeah, to me, it's very important, and it's something that not a lot of people are doing, and we're happy to do it. And, for me, it puts together, I love sports, and I love the eyes, and, it's fun for me. The ultimate goal is to be able to work with shorts and a t-shirt on, right? So then it's just very comfortable and chill location. So
yeah. Well, talk about spatial awareness in sports. For me, what comes to mind is I play pickup basketball. I coach youth basketball, so I just like basketball. And I've rolled my ankles a few times over the years, a couple of severe ankle sprains. And it's usually because you come down wrong. Come down wrong, and you may not have been aware of who was around you. And so I just wonder if something like that may
absolutely, man,
help. I can kind of see, even though I'm looking up, I can kind of generally peripherally see what's going on around me, that I may want to land with my foot a little bit differently, or whatever.
No, and with that as an example, the answer to that is absolutely, right? The more that you can play the game that you're doing without actually having to see that specific area, the better you're going to be at it, and then the healthier you'll be. When you talk with basketball players, or you train basketball players to do things, it's like, hey, your side, we're going to work on the eye side, and I need you to always be focusing here, but you have to be aware of what's going on over here, because not always are you going to hear somebody call out for that pick that you're about to get nailed with, right? And so you got to know that it's there, not to necessarily duck it, but to brace for it to come, so that you don't end up getting hurt. And just
usually
likewise,
that pick does not get called.
The pick, it's not going to get called. But in that same thing, if you're jumping up and you've got 3 people under you, you need to know, hey, there's a possibility for this, and you're going to cushion yourself for some kind of different landing, or land in a different way. So yeah, absolutely. It's, spatial awareness, peripheral awareness, absolutely necessary for sports.
So you are the team eye doctor for NC State University Athletics. Give us some examples of how you've worked with different teams at NC State, and maybe different ways you've been able to help those teams, or what are some things you guys are doing? What are some things you guys are working on?
So, I'll use the football team in an example. We've worked in the past with them on working with some of the wide receivers before the game, getting their eyes activated. But during the week, we work on doing the same things, where we'll go through, hey, what of your routes or of your catching positions, what is it that you find to be a little more difficult than normal? Is it, hey, I'm catching the ball over my shoulder, it's not as easy? Is it the ball coming this way? And for me, when you just sit and talk to them that way, and you never want to ask an athlete what's a weakness, because in all honesty, at that level, there's not a weakness. It's like, hey, what can we get to be better? But if somebody tells me, hey, I'm having trouble catching it over my right shoulder, but my left shoulder, I'm fine, that to me is indicative of, okay, we need to strengthen vision in the right eye. If they're telling me the ball coming at me when I'm looking at it this way is a problem, it tells me we need to work on convergence in how both eyes work together, right? So you have that conversation, and each position's different. If I'm talking to a wide receiver, it's different than if I'm talking to a linebacker. If I'm talking to a cornerback, safety, offensive lineman, defensive lineman, everything changes, and it's the same on the basketball court. If you're talking to a point guard versus a forward, power forward, small forward, am I the one who's going to be rebounding behind the block? What am I doing? What's my positioning on the court where I'm going to be? Baseball, softball, pitcher, am I a hitter? All of these things. So you have to understand both the sport, but then understand the visual load that they're going to be taking so that you can figure it out. And then once you understand, okay, this is where we're working on, you'll isolate that just like any other muscle. Hey, we're going to work on it. Sports vision is vision therapy, is physical therapy for the eye. It's amazing how it ties in when it's explained, right? Like when people understand, oh, yeah, that's right, I do need to do this. Like when I'm closer in basketball, for instance, when I'm closer, I'm binocular. When I'm further away, I'm monocular. My lead eye is taking it out there. So it's like, well, why don't we work on improving that lead eye? If I'm right eye dominant, are we seeing as well as we can? Can we then cover that right eye in training and make us see how well we're going to shoot with the left eye leading? So that way, if a defender does learn to start blocking off the eye that goes there, does that affect how you end up shooting? Does it affect your percentage? So, there's a lot of people, I guess the poster child now in the NBA for doing like sports vision training and things like that is Steph Curry. And everybody knows that guy's like the best shooter of all time. And he's consistently working on, giving his eyes deficits and then improving and going from there and using different tools to make him be able to see better, see quicker, and react quicker with his eyes.
How important is data then to, I guess, are you creating benchmarks to understand kind of where someone is initially and then how to progress?
Yeah,
how
so
to track
absolutely.
progress?
So you want to have a baseline, and for us, everything starts with just the initial eye exam. You want to make sure, hey, are they corrected to where it's at? Because in a world, and you say this to all of your athletes, regardless of what level they're at, is, if you're seeing 20/20 or 20/25, that's amazing in the real world, right? But on the field, on the court, that's almost like, man, I've got like 5 or 10 feet behind that next person of perception of what I'm able to see. So, 20/20 means things that are 20 feet away look as if they're 20 feet away. 20/25 will mean it's 20 feet away, it looks like it's 25 feet away. So already the gap between that person is 5 feet. They're perceiving it 5 feet quicker than I am. Well, most athletes are 20/15 and better. So yeah, 20/20 is great. Yeah, you don't need glasses if you were just going to be regular me or you out in the world. But hey, you're trying to go professional, or you want to make it to college and be a D1, D2 athlete. This is the way you can get better without physically getting better. We're improving you eyes to brain, and then physically your gifts will carry you. So there's a lot of just slow, oh yeah, that is sharper. Oh man, I didn't realize that I wasn't seeing things as clear. And then it's like, yeah, there it is. Because again, perception is it. If you're 20/20, why do you need a correction? Well, you don't. But if you're on the court and you're saying at night the lights bother me, or the flashes from the bulbs and stuff bother me, then it's like there's something in there that we can work on to help improve that.
Well, the perception around what may be somewhat of a newer science of sports vision, I think the value and the perception of the value of that is continuing to rise. Obviously, we're seeing it at NC State and the work that you're doing there, working with all different types of teams there, improving everything from shooting percentage to, on the football team. I know you're important to the football team because I saw you on TV standing right behind Coach Dave Doran.
I hope I'm important to the football team.
I mean, you're standing right behind the coach on TV, and I'm like, hey, there's Amjad.
Yeah.
So to be there on the sideline as their eye doctor, I think, speaks volumes, the fact that, the coach wants you there.
Yeah. Well, it's, and I give a shout out to the training staff, because part of being there at the games is more for like injury prevention as well, right? Like I say, hey, at the beginning of games, you activate and you work with the athletes to do stuff, but you don't want somebody's eyes to get poked out or something. This year we had an opposing team come and one of their players got poked in the eye, had a pretty bad like inflammation and whatnot, and we had to check, make sure, hey, is he okay to come back in? Is he clear to play? Is he going from there? And even that other training staff were like, oh, maybe we should have like an eye doctor there. And like that made me like, be like, oh, cool, because I advocated for it, like to be there and to do that. Because again, I think the awareness, like you're saying, of, what is sports vision, a lot of people don't know about it. So like, it's cool to see it. But like there are programs, around the country, like Alabama, who've taken sports science to another level. And like what their team eye doctor and, everything else they're doing is at another level. And we see, Nick Saban at that time. Yeah, absolutely. Values any edge he can give. He's working on giving it. And I think, I love, been an NC State fan my whole life. I'm an alumni, and I love that now I'm able to hopefully be able to help, get them to that aspect as well. Like to be like, okay, we can get a little edge here. Let's do it. And maybe that ends up helping down the road, and that would be amazing. So as a fan and then as, the doctor.
Yeah. Well, having gone to NC State games and seeing how rabid the fans get, there might be some eye poking going on in the stands. So I mean, they might be calling for the eye doctor because they get a little crazy over there.
Yeah, we do get a little crazy.
Let's play a quick game.
Okay.
Myth or truth?
Oh God.
Okay. Myth or truth?
Are we fact checking this or?
Well, and you haven't seen this. So.
Okay.
All right. So I'm a parent. You're a parent.
Okay.
And I know my parents said this to me. Sitting close to the TV is going to kill your eyes. It's going to damage your eyes because you're sitting way too close to the TV. You've heard this. Myth or truth?
Can I say in between?
All right. Yeah, you can say whatever. This is your show.
So like if you're this close, obviously that's a problem, right? If you're a good 3 to 5 feet away, not as good as being further away. It's more about just processing and how your eyes are. I think the better way to look at it is if you're uncorrected and you're sitting that close to the TV, probably means you need glasses, right? Like to be able to see. And that's where a lot of kids are seeing there. I do know that with all of the upgraded, like LED, LCD, TVs, it's better for our eyes than what the tube TVs were back then. So that's why there's some truth to it. But now if you ask me, hey, what's worse for our eyes? I'll tell you giving them an iPad or giving them an iPhone or, Android or just a tablet or a cell phone, a smart device is, way worse than having them watch the TV.
Because it's smaller and you're having
smaller, it's right there and they're focused. They're not breaking and, they're not blinking and they're not allowing their eyes to take a break when it's that close. And what ends up happening is they just are on it for, 30, 45 minutes at a time without taking a break, where you hope with the TV, they hear something, they look away. But man, when they're focused in on those tablets, there's no looking away. They're just like in and out of that zone.
So that's a lead into the next myth or truth.
Okay.
Those of us who work in an office or we're looking at computers all day, is staring at the computer all day bad for your eyes? Myth or truth?
Truth. Oh, 100%. So things you want to do, we call it the 20-20 rule. Yes, we're dorks. We have, that. But for every 20 minutes you're on a screen, look away for 20 seconds. When you're looking at your screen, you need to make sure you blink, looking at various like research points, but let's just use one that I know. If you're supposed to blink 15 to 20 times a minute, that's what we're supposed to blink. When we're in front of
blinking more now that you're telling me this.
When we're in front of devices, we only blink 3 to 4 times a minute. So, you've now switched that. And what does that do? Well, it doesn't give your eyes a break. That's why people have eye strain at the end of the day. It leads to, potential you changing how you adjust. That's why you can end up with, hey, I'm having neck issues and whatnot, postural issues, right? But it leads to dry eye, and, we've talked in the past about dry eye and stuff like that. But when you're not blinking, you don't get your tear film spread on your eye properly. And then if your tear film isn't there, your vision isn't as clear. So, I tell people from the beginning, if we're not blinking right, you're not going to feel right. You're not going to see right. Blinking is like pressing the windshield wiper fluid button for your windshield. If you don't blink properly, it's like, partial blinks where you don't go down to get the oil to come out. it's like now you're pressing the windshield wiper button without the fluid coming out, and that's how your vision's going to be. That's how your eye's going to feel. So, yeah, staring at a screen all day without taking breaks, horrible for you. So, look around, blink more, and just remember to blink. That's really one of the bigger ones.
Mm-hmm. Myth or truth? Eating carrots are good for your eyes.
So, eating carrots are delicious. So this is I love carrots. So I don't want to take that away, but that's a myth. The amount of carrots you would have to eat for it to actually give you the benefit that you want would like actually turn your skin orange. So you essentially food poisoning. So taking beta carotene supplement, like taking a multivitamin with beta carotene, and it's going to be better.
Yeah, we don't want to turn into Oompa Loompas.
Yeah. So not at all. Definitely don't want that.
All right. Well, if you cross your eyes, this is people believe
I
this.
know.
They'll stay that way.
No,
if you you can like mess up your eyes by doing things like that.
Look, you can mess up your eyes. You can mess up your eyes in many ways, right? Like, hey, I'm staring at something too long. You're going to mess them up, but they won't stay that way. That myth's always been funny to me, even from when I was a kid, and you'd hear that. Yeah, myth.
As I guess, if I'm an eye doctor, or I guess for you, like what sort of eye conditions? I mean, is it something that you're seeing frequently, or is it something that you see rarely, but that kind of really worries you? Like it kind of keeps you up at night in terms of an eye condition that is just really harmful, that we should be aware of, that either potentially could happen to us or others that we know, or just some, what is that one thing that just, there are lots of different eye conditions.
I would say for kids, it would be myopia. We're currently worldwide, they've considered it a worldwide epidemic of myopia where prescriptions are jumping at higher rates than they're supposed to. They've tied it down to the amount of screen time that kids are using and the lack of time outdoors that they're playing and getting sunlight to go in. So it's just too much of that long focused time here. Like we said, hey, it's damaging to adults. Well, it's way worse to kids as their eyes are still changing, their body's growing. It's leading to higher prescriptions, which puts them at higher risk for retinal detachments in the future and, just other visual problems. I would say that on the kids side. In adults, honestly, it's dry eye. You go back to it. It's a pretty big thing in the sense of our patients, we have a pretty robust dry eye clinic, and our patients who have severe dry eye, it's not fun for them, right? Like, so if we don't feel it, we don't know it. And, I always talk about dry eye as one of those that it's difficult to help people understand the seriousness of it because it's both a symptom and it's a disease process. So if I don't feel the symptom, the disease process can still be happening. It's just like somebody who has diabetes. If they're on medications, I still have diabetes, right? Or, hey, I don't know I have diabetes, but stuff is going on in my body and I don't realize that. So I think it's a serious condition that people don't understand, that damage can be happening despite not having the symptoms for it. And I think that's where it's tough to explain it to patients when they come in and you see it, is that, hey, your eyes are showing signs of severe dry eye, like gland dropout, atrophy of, things that are necessary for us to be able to have a proper tear film. Oh, but my eyes aren't dry. It's like, your eyes don't feel dry, but your eyes are dry, right? So I think those are the two. I'd say in adults, dry eye, and kids, it's myopia, and those are very common. So it's not like it's something that's, we got to be good. No, this is the majority of the population, afflicted by these things. So.
All right. Well, with that in mind, I'm going to close my computer screen and just not look at a computer or a screen or anything for the rest of the day. Actually, nice. I don't know if I can do that, but I'll try.
Try. Yeah, there you go.
Try. And maybe, and hey, get outside.
Yes, absolutely. Get outside, man. For kids.
I forgot about that.
For kids, we want 90 minutes a day outside. Yeah. We want to. Yeah. I think part of, what parents are telling me as they're seeing with their kids is like, man, my kids don't interact with other kids anymore. And it's just like, because they'll talk to their friends via phone, but then they're in person and they're just texting or whatever each other. So it's like, get them off the phone, get them outside, get them playing, get them doing something where they're not just in front of a screen 24/7.
We used to go outside and play, and I mean, our parents didn't let us hang out inside.
Yeah.
Like, it wasn't really an option.
Yeah, they didn't want us to get out. They didn't want us in the house.
Now the kids are playing online.
Yeah.
And So yeah, I think that's the change. So we have to work toward that. But hey, thank you for joining us.
Yeah, man.
It's
Appreciate
been
you
great
having
to
me.
kind of talk about the eye, all these different topics, both in terms of how it relates to daily life, how it relates to sports.
Yeah.
So I really appreciate you joining us on the On Brand
Yeah.
podcast. And again, Dr. Amjad Badwan with
Wake
Family Eye Care.
Yes.
And appreciate it. Thank you.
Yeah, thanks, man. Appreciate you having me.
All right.
All right.